So friends, welcome to the rotator cuff repair workshop. So in this workshop, we will be demonstrating about doing rotator cuff surgeries from Arthrex instrument set. Now Arthrex has got a very wide portfolio regarding rotator cuff repair, and we will be demonstrating all the anchor options and the instrumentation options that we have to do the surgeries for rotator cuff repair. So if we see about the anchors, you can just focus here. If you see about anchors, Arthrex has got a very wide range of anchors, ranging from metallic anchors to biocomposite anchors to PEEK anchors, and then they have a knotless options available as well. So this range is basically called as a Corkscrew range, and Corkscrew is basically I'll say it is one of our preferred anchors as far as the rotator cuff repair is concerned. So if you are using a first generation single row technique, or if you are using a double row technique by regular anchors, or the medial row of the double row technique, we will be using the Corkscrew anchors for the medial row. Now, if you can appreciate, this anchor is basically called as a Corkscrew, and this is available in multiple sizes. So this is a 5.5 mm option. And if the patient is osteoporotic, you have a 6.5 millimeter options as well. So if the patient is osteoporotic and the smaller anchor pulls out, you have an option of putting a bigger anchor here. So this is a 6.5 mm anchor, and this is a 5.5 mm anchor. Now, if you can appreciate, a very important phenomenon in this anchor is when you open it, it basically does not have any eyelet. So when we open the anchor, there is no eyelet. So the hinge or the wire is loaded on the tip of the anchor. Now this is a very important feature of this anchor, and this is one of the feature which makes the pull-out strength of this particular Corkscrew anchor much better than any anchor which has an eyelet. So at present we are recommending anchors which do not have an eyelet and which have this sort of a female sort of a attachment. So this basically attachment is better because you will have a purchase from the cancellous bone as well as the cortical bone. So this is one of the preferred options if you are using a metal anchor. So if you are using a metal anchor, avoid the anchor with an eyelet, and we are recommending strongly anchor without an eyelet and which has a wire which is coiled up to the base of the anchor. So this is about the metallic anchor, and you can use this anchor. Now similarly, we have options of non-metallic anchor as well. So we have again an option of 4.5 and 5.5 mm anchors. Now these Corkscrew anchors are available in biocomposite as well as a PEEK material. So this one, if you can appreciate, is a PEEK material SwiveLock 5.5, and this is a biocomposite material SwiveLock, and this is 4.5 mm. So these are different variations. Also, you have a double loaded and triple loaded options available for all the anchors. So if you are comfortable, you can use a triple loaded anchor as well. Using a triple loaded anchor is good, but you need to be very vigilant with the suture management because there are lots of anchors, a lot of sutures inside the shoulder. Now coming to the lateral row portfolio. So this is the lateral row portfolio from Arthrex. So this comes in the SwiveLock range, and in SwiveLock we have an options of 5.5 mm SwiveLock, 4.75 mm SwiveLock, and this is also again available in biocomposite as well as a PEEK material. And then we have an option of a metallic tip also. If there is a metallic tip, it becomes a self-punching SwiveLock. If it is a non-metallic tip, you need to prepare with the awl. So this is the awl which we use, and this awl we can appreciate there are two marks. The first mark is for the FT. This is for the Corkscrew insertion, and the second mark is for the SL, that is for the SwiveLock insertion. So this is the anchor, and this is basically the inserter which we use for the Arthrex anchor. So this is a universal anchor inserter. You can use it for Corkscrew, bio, PEEK and SwiveLock. FT is for the Corkscrew and SL is for the SwiveLock. So it's a universal inserter. Sometimes if you are using a SpeedBridge set, you will be provided with a disposable inserter. So that is a plastic inserter, and if you are using a SpeedBridge set, you will be provided with a disposable inserter in the SpeedBridge set itself. So this is about the rotator cuff anchors. Now as far as the instrumentation is concerned, they have got very good two cannulas. This is a 6.5 millimeter cannula, the green one, So this is a green cannula with a green inserter, and 8.25 cannula, yellow cannula with a yellow inserter. Okay, and the cornerstone of the rotator cuff repair is this. This is called as a shoulder scorpion device. This is a very good device as far as the rotator cuff repair is concerned. With finger knot pusher, and then you should have some passing devices. So if this, you see this is called as a bird beak device. So this is a very good device for passing. The other good options are penetrator device. So the Arthrex has got penetrator and bird beak for passages through the cuff. Now bird beak is available in different sizes, and penetrator you have a straight option and a 15-degree up curved option, and these are very good devices to pass the tissue from the retrograde aspect. So you have to use another portal and pass the devices through the cuff, and then they can retrieve the sutures from the anchors like this. Now this one is called as a curved passing device. So this is like a curved passing device, and this can also be used for rotator cuff passage. This is called as a suture retriever. If you can see, this is called as a suture retriever, and again this is a very useful device to retrieve the sutures from the set. And now this is basically a device which can grab the cuff, and you can see the mobility of the cuff by using this device. So this is called as a grabber device, or you can also grab the rotator cuff and see the mobility and assess the pattern in which the rotator cuff is torn. Besides that, you can see that this is basically the other parts of the set. So you have a passport cannula inserter. This is also a very good thing. And then you have rasps available, you have an elevator available, and then you have inserters for fiber tack, etc. in this particular set. So as far as the technique of rotator cuff tear is concerned, there are generations, and we will be focusing and we will be demonstrating the different variations of the anchors and the generations accordingly. Now rotator cuff has evolved over time, and initially it was a single row repair. So if you have to do a single row repair technique, then what you need to do is you need to put your anchor in the midline of your footprint. So if this is the rotator cuff, you put your anchor almost in the midline of the, you have to put your anchor in the midline of your rotator cuff. So that means that you need to put your anchor between the cartilaginous level and in between the lateral. So approximately the width of the tendon is approximately 2 centimeters. So you need to put your anchor at about 0.5 to 1 centimeter lateral to the cartilaginous end of the shoulder. Once you have done that, you use your shoulder scorpion device. So this is the shoulder scorpion needle, and this is basically disposable, and you use it along with a shoulder scorpion device. So this, you can see, is a black needle. This is as compared to the red needle. The red needle is for the knee scorpion, the black needle is for the shoulder scorpion. We'll just open it up and we'll put it into the knee scorpion, into the shoulder scorpion, and it fits like this. And when you grab it, it will come like this. Okay. Good. So when you have to do a single row repair, you will do it with a Mason-Allen technique. What that means is you need to pass 2 sutures like a mattress and 1 suture like a simple, or 1 suture like a mattress. So what we'll do is we'll pass the first bite like this. Okay. This you can use either as a simple suture, and then you can use 1 suture as a mattress. So this is more deeper bite. The single suture is a more deeper bite, whereas the mattress suture is a more shallow bite. So what I am doing here is okay. So what we have done is we have used 1 suture as a simple suture
and one suture as a mattress suture. So this is called as a Mason Allen. You can use this one suture which is a triple loaded anchor. So this you can use as a simple loaded. And what is actually meant by a Mason Allen suture is you tie a mattress suture like this. Here we are tying a basically SMC knot, that is Seoul Medical Center sliding knot, and we put it like this, okay, and we use our knot pusher. So this is our post, this side is acting as a post, and we close it like this. So we put it here and we lock it here, okay. So this is a mattress suture. Once we are done with that, knot cutter please. Or you can do, so this one is your mattress suture, and then you can do your simple suture. So this is the simple suture, and this is basically again a SMC knot. This works like this. Okay, so this is again an SMC knot. Okay, it closes like this. Okay, so this simple knot and the mattress knot are basically crisscross each other. So the first knot, the simple suture, is over the mattress suture, and what it does is it prevents the cutting through or the cheese cutting effect of the simple suture. The mattress suture downstairs will prevent the cheese cutting effect or the cut through effect of the simple suture. So this is basically called as a Mason Allen construct, where one suture is acting as a mattress suture and the other suture is acting as a simple suture. The simple suture is over the mattress suture, and this suture here will prevent the cheese cutting effect of the simple suture. So this is the first generation of the rotator cuff repair technique. So this is basically you can do it for small tears, and in also massive tears also you can do this sort of a technique to repair the rotator cuff. So this is basically the construct that we use for the first generation rotator cuff tear. Now coming to the second generation you can use basically it is a knotted technique, but it is double row. So what you need to do is you need to put 2 rows of anchor. So here what are we doing is we are putting the first row of the anchor here like this, okay, and then what we are doing is so this is the medial row, and you can make the lateral row with a simple suture only. Here you pass the suture 4 times, and for the lateral suture you pass it 2 times. So the medial suture is a mattress suture and the lateral suture is a simple suture. So thereby you can do a double row repair without using a knotless technique. This is less usually used. Now we are coming to the third variation. The third variation is basically the knotted double row technique. Here we are using an anchor on the medial aspect. Okay, and what we do is we pass the sutures in a mattress fashion. So that means that we will pass both the sutures here in a mattress fashion. If it is a double loaded anchor, you can use it. So if this is a double loaded anchor, you can use that as well. You can put 2 anchors also, and you have to tie these sutures back into its place. So what you can do is you can just tie them as you do any other regular suture. Okay, and thereby you tie these sutures back into its position. Okay, so the medial row is basically a knotted anchor. So this is basically a knotted repair on the medial aspect like this. And once you are done with your medial repairs, you will put your SwiveLock anchor on the lateral aspect. So what you can do is, like, you will have multiple suture limbs. Like from here, you will have 2 suture limbs extra, and those suture limbs can be incorporated into the SwiveLock, and this can be inserted as a lateral row anchor here. So I'll just demonstrate you how you do that. So what you need to do is you need to just pass this sutures here like this. You can pass 2 of them. Or because you can just use one of them, and then you put it into the knot. You ask your assistant to pull it like this. Can you hold it for me? And you need to tension it. So this is your SwiveLock. This is your tensioning. So this is your lateral row anchor. Relax. This is your lateral row anchor. You need to tension it like this. You need to tension it like this, and then we need to rotate it and tie it over the SwiveLock in full tension. Ask your assistant to hold both of them like this, and then you slowly insert the SwiveLock into its place. So this is how a 3rd generation rotator cuff repair is done. So then we remove it, and you can see that the inner medial row is a knotted anchor and the outer thing is a knotless anchor. Then you will have 2 sutures which are coming out from here, and these sutures you can actually use them for a dog ear reduction. So the sutures which are coming out from the SwiveLock, you can use it for a dog ear reduction technique. These are the sutures which are coming out from the SwiveLock. You take this out, and these are the sutures which are coming out from the SwiveLock, and these sutures can be used to do a dog ear reduction. Supposedly you see a dog ear here, you can just take the suture through here and use this particular suture in a particular manner to reduce and repair the dog ear. So the SwiveLock anchor will give you an option of doing a dog ear reduction with the free stitch that is provided along with the SwiveLock. Now this particular option is not available in other anchors. So other companies' lateral row anchor, you may not get a central suture which is used for a dog ear reduction. So this is an important benefit that we get, that apart from doing a knotless repair on the lateral row, we are also getting one suture which we can use for the dog ear reduction, and this is basically called as a dog ear reduction suture. So this is basically the 3rd generation of the rotator cuff repair, in which the medial suture anchors are put, the knots are tied, and then it is incorporated into the lateral row. A special suture limb, extra suture limb of the SwiveLock can be used to repair the dog ears, if any, coming out of the double row construct. Now the 4th generation of the repair is what we call as a SutureBridge technique. Now SutureBridge technique is a unique technique in which what we can do is we can use a knotless technique without tying a knot. So if you want to do a SutureBridge, what you want to do is you want to put your medial row anchor like this. Now there is a SutureBridge kit which is available in Arthrex. Otherwise what you can do is you can put your anchor like this, okay, and then you can just take out the suture limbs, and then the original SpeedBridge actually has got SwiveLock on both the sides, and you have tapes to do that. But what you can do if you don't have a SpeedBridge is basically the medial row anchor is used to pass the sutures one by one. So this is the first, this is the second, this is the third, and this is the fourth. Now this is what is called as a parachute technique. here this is ideally to be done with tapes. So you have anchors with tapes, and in the SwiveLock kit you will get tapes along with that. So what we need to do now is we need to pass all these 4 suture limbs through you will stop. So in the 4th generation technique, which is also a SwiveLock technique, you don't need to tie the knots on the medial aspect. What you need to do is you need to just pass the sutures from the medial suture anchors, and these sutures are incorporated into the SwiveLock. Normally you can put up to 4 suture limbs or 2 tapes into the SwiveLock very easily, and this way you don't have any knot coming up here, and you can repair you ask your assistant to give a manual traction and to the sutures, and these sutures can be tied one by one onto the SwiveLock anchor in appropriate tension like this. Please remember that we have not tied any knots so far, and we are just relying on the tension of the medial row anchors for a good repair here. So what we have done here is we have pulled the medial row anchors through the eyelet, tensioned it up, put it in like this. We have hold it into its position, and then we will be just inserting keeping the sutures in tension, we will be just inserting the SwiveLock anchor in. Again, we will be just leaving it. We'll just release the tension now. And now you can appreciate that we are able to repair the cuff without putting any knots on the medial aspect, and this is 4th generation of the rotator cuff repair. Now Arthrex has beautifully designed SwiveLock kit for this sort of a repair. The kit consists of 2 medial rows SwiveLock which are loaded with tapes, and 2 lateral rows SwiveLocks which are without tapes. And the beautiful part about the SwiveLock kit is the tapes are interlinked, so you need to pass only one passage of the tape. So both the tapes are linked in the end, so you just have to pass one tape from each of the aspects. The extra limb of the SwiveLock you can use as an extra suture to tie it medially, and then these tapes are, once they are passed, they are cut side to side, and you can use 2 medial and 2 lateral anchors, 2 SwiveLocks on the medial aspect, 2 SwiveLock on the lateral aspect, and thereby you can repair it. And this is basically the 4th generation of rotator cuff repair. The advantage of this particular technique is you don't have to use a knot on the medial aspect, and thereby the devascularization of the tissue is less as compared to a knotted technique. So basically this is the fourth generation of the rotator cuff repair that you can perform. Usually all of them have their indications of their own. For a small tear you can do a single row technique which we have described here. This is a single row technique. If you are doing a single row, you need to use a Mason Allen technique. Double row, as I told you, 2nd generation is not very popular, but you can use 1 medial and 1 lateral suture anchor. Repair it. The medial row is a mattress, the lateral row is simple. The 3rd generation is basically you tie the medial anchors knots and then use a SwiveLock anchor on the lateral aspect. The 4th generation, you don't tie the knot on the medial aspect, you just use the sutures on the SwiveLock on the lateral side, and this will give a sort of a parachute technique to reduce it. And a more advanced version of 4th generation of rotator cuff repair is basically the SwiveLock technique which is developed by Arthrex. Thank you.